Hello and welcome to the Introduction to Healthcare Data Management and Analytics. I'm Dr. Stephen Harty, the coordinator of Academy Research Network, and I'll be your resource person throughout this course, and I do hope that I will not bore you.
This course is supported by the Health Records Officers Registration Board of Nigeria and the Association of Health Records Information Management Practitioners of Nigeria. We're also having resource support from the Ministry of Health and the WHO. Remember that this course is an extension of the Nigerian Health Information Management System conference held in June 2021. There was a need to strengthen the skills of health records information managers across the country. Hence, we're taking this course. Now, remember that this course contains two components. First, there will be healthcare data management discussed over modules 1 to 3, and then healthcare data analytics discussed through modules 4 and 5. And remember, again, that this is an introductory course. We'll begin module 1 with an overview. We'll be going through what healthcare is, whether as single words, compound words, hyphenated words. Then we'll look at what data is, and then we'll look at what healthcare data is. We'll briefly look at the benefits of healthcare data, and then give us an insight into what the future holds in healthcare data. Now, I felt it's important for us to look at these words. They appear often, and we see them, and we could just be careless about it. It's important for us to be well informed what it means. Now, when you find the word healthcare jointly or healthcare hyphenated, it actually means, or it refers to the entire healthcare industry itself, or is describing a specified facility where this healthcare takes place, or a system of healthcare delivery. Okay, so that's one. And then secondly, we find the healthcare with respect to those individuals or group of people involved in delivering the healthcare. So it's important to clarify this before we go on. In this course, however, we'll be dealing with healthcare as one word, and it will also mean both the system, the industry, the facility, as well as the caregivers, the individuals or group. Please note. Now, let's try and define healthcare. We have a general definition we find almost everywhere. Okay, if you check out the reference underneath, you would find this definition. It's a general definition, and it refers to the maintenance or the improvement of health via preventive, diagnostic, treatment, recovery, cure of disease, injury, illness, and other physical or impairments in people. Okay. We also find a more extensive definition in which the healthcare definition is related to the people who drive the activity itself. So we look at healthcare from a general point to a people-driven activity in which the prevention, the treatment, the diagnostic, the management of this illness and the preservation are actually offered by medical and allied healthcare. It's important to mention this because we find ourselves in the midst of this as healthcare or health information managers or health records and information managers in this system. So we see healthcare as people-driven. We also see healthcare from the definition of primary healthcare provided by WHO and UNICEF, in which primary healthcare is defined as a whole of system approach. It talks about improving the highest possible level of health, okay, and all that. But most importantly, it included health promotion, which you find very peculiar in this definition and which we need to take note of. Health promotion, maintenance, preventive, diagnostic, okay, the treatment and cure, rehabilitation, as well as health promotion. We can also see the definition of healthcare from multidisciplinary activity. We would see healthcare defined as a multidisciplinary activity involving those who drive medicine, medical care, whether internal medicine, whether dentistry, pharmacy, pharmaceuticals, the nursing, obs and gyn, physical therapy, athletics, okay, all other professionals that are involved in the healthcare delivery system. And so we look at healthcare as multidisciplinary. Now, all these activities results in the generation of data. And therefore, we can define healthcare data simply as the documented records, documented data, documented observation, information generated from the activities in the course of healthcare delivery. And so healthcare data are generated whether for the facility or for the system or the caregivers themselves or professionals involved in it. Healthcare data are also generated, most importantly, for the clients, customers, or patients that interact with the healthcare system. And I think that's where the major focus is. The reason for putting together healthcare data, or the reason to focus on healthcare data, would simply be for saving lives and maintaining well-being. That's just as simple as it is. But specifically, we save this data, we store this data for processing or for referencing purposes. We also go back to this data to draw informed decision, and that's what we talk about, and that's why we talk about evidence-based medicine or healthcare. Healthcare data has also been very useful in surveillance and outbreak prevention. For example, COVID-19, the surveillance of this disease has been supported by data that's collected through surveillance of its outbreak across the world. Healthcare cost is a very important component in the healthcare delivery system, and the struggle to reduce this cost, the understanding of how to approach the cost reduction, can actually be looked at from the point of healthcare data. When we have good quality healthcare data, we'll be able to reduce cost of care from it. Another very important component, the reason we're talking about this today, is if we keep good healthcare data, we'll be able to perform good analytics, and it will also promote artificial intelligence activities within the healthcare system. Business development to maintain competitiveness for healthcare facilities or for the healthcare industry or for those who provide them, they need healthcare data to be able to achieve that. We'll get more information in the link that I have there under. So healthcare data is very vital. That the future of healthcare data will rely mostly on blockchain technology and the artificial intelligence. So it's very important for us to pay attention to this and begin to look into this direction, improve our skills and competencies in this direction to be able to fit into the future. With that being said, I hope we have a clearer understanding of what it is now to look at healthcare. And so I expect that in the course of this discussion, we should share our thoughts on what healthcare data is, and we need to do that on the discussion forum. Please visit the discussion forum and share your thoughts with us. Thank you for listening.